Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
What is up, fam? This is another exciting episode of Vitality Vault with Dr. G, me, and the lovely Dr. B. Dr. B, how are you, my dear?
I am doing quite well today, thank you. How are you doing?
Can't complain. I am recording again with you. Love doing these with you. I think it's going to be good for people to hear what the topic is today. Now, before we get to the topic, I got something important. This is important PSA.
Okay.
I got cool socks on. Now, if you know me, I'm a sock guy. I love crazy socks. So today I'm wearing in honor of my two boys, my Mario socks. You see there's yes. Mario right there? Yeah. So I plan on wearing a different pair of socks every single episode, Dr. B. You ready for that?
And he really does have enough to do that, yes.
She keeps trying to get rid of them, but they're not going anywhere. I love me some socks. Now, on to bigger things. So we are talking about brain health and inflammation today.
Yes.
What have you seen in your practice with regards to that? Are you seeing much of that? What's your take on that?
Absolutely. A lot of brain inflammatory related conditions. And I just think it's related to, like we've spoken about in the previous inflammation episodes, diet, the exposure, changes in our bodies that come along with age, like hormone changes, and anything else that we're exposed to or we're doing that's causing increased stress and inflammation definitely can affect the brain, can affect our memory, our thought process, concentration, and can actually down the line cause some actual disorders that we can diagnose by various testing. So yes, I'm seeing more and more brain inflammation, unfortunately. But today we're going to be talking about signs and symptoms to look out for. We're going to be talking about what you should talk to your doctor about.
Definitely.
If you experience any of this, and kind of give you some, some tips on things to do, foods to eat, types of exercise, supplements, different things that you could do to improve in your brain health. What about you, Dr. G? Do you see?
I mean, it's an exploding, I call it an epidemic with all the different maladies or disorders we're seeing coming down the pipeline caused by inflammation, especially in the brain. And the thing is, a lot of it is preventable. A lot of it, if we just are more intentional with certain things that we do and how we live, we don't have to see as much of an explosion in these chronic conditions as we are seeing or are projected to see in the coming decades of life. So to start off, we're going to talk about, ways that you should be looking at the brain. Okay, the brain anatomy itself, your brain is made up of billions and billions of neurons. And what neurons are, they're basically the tiny cells that transmit information from one cell to another and gives you, allows you to open your hand, to turn your eyeballs, to see. I mean, there's so much that the brain does that people don't realize that the minutia of life is controlled by the brain. We're also going to talk about inflammation in general. Now, we already know from previous podcasts, right, Dr. B? There's acute and there's chronic. And inflammation is not bad. It's actually a good thing in the acute phase because it leads to healing. Is when we do things that keep the inflammation, like an unwanted house guest to stick around, or like a squatter in your property that just doesn't want to leave. That's when you end up with issues. And some of the major brain disorders that we're seeing on the upsurge or rise now in the public is Alzheimer's disease. That's a big one.
Big one, yes.
I mean, Parkinson's. We're going to see more of Parkinson's too coming down the pipeline. It's also neurodegenerative, just like Alzheimer's. There is a link to depression, or the increasing episodes of depression we're seeing, and brain inflammation. And MS is a big one, multiple sclerosis, also autoimmune. Now, there are others. We just picked these 4 because they are 4 of the biggies. You know, that's not to say the others aren't important, but I think the first 2 we had on the slide there, which is Alzheimer's and Parkinson's, those are definitely on the rise in our practice for sure, and as people age.
Yeah. And there is a genetic component to some of them, including especially those first 2, MS as well. But again, like we spoke about in the other episodes of inflammation, you have had to have exposure, or create that inflammation in your body that would trigger those genes to express themselves. So you can, even if you have a family history of it, you can be very proactive and do certain things to help to reduce the inflammation, reduce the chances of you developing those conditions full-blown in the future.
So if we look at the factors that can contribute to, brain inflammation, you mentioned genetics, which we know. Your genes are one thing. The genetics, what loads the gun. Epigenetics, or the way you live, will fire that gun. That's one way to think of it. So when we look at diet, we talked about this before, and it's worth beating a dead horse. Diet or lifestyle is a lot of what we're needing to change to get things better. So processed foods. These foods are typically chock full of inflammatory chemicals and dyes and all these things. And that's one way you're going to see increased inflammation. Now, to combat that, you want to go the route of the whole foods. You want to go fresh, green vegetables, things that are mean green, the Hulk type foods. Exercise, very important. We know exercise is good because one, it not only increases the amount of endorphins in your system, it causes the blood vessels to dilate, increasing blood flow to the brain.
Absolutely.
And the brain needs blood. And the more we give it inflammation, or the more there's inflammation in the brain, the more you're going to starve the brain of oxygen. Sleep. We talked about this before. Once again, we're beating a dead horse, but I love beating dead horses with regards to this stuff, by the way, not what people are thinking. Poor sleep will increase inflammation. I mean, it's one thing to say, I can get by on 3 hours. That is until you begin to forget how to use a spoon. Then we know that problems are happening. Okay? Stress management. Now, I don't think any of us live in stress in the U.S., right? There's no such thing as stress, no, right?
Never.
No. But for those of us who suffer with stress, it's important to find ways to deal with that stress, whether it be through therapy, talking to your healthcare provider, your physician, on ways that you can combat stress, or even adjusting the way you work. That can definitely help. And we look at environmental factors. There's toxins, heavy metals, all these things will definitely affect cognitive function and increase inflammation, and head injuries. The football players, there's a huge, I know it's big now where they're talking about CTE and the fact that a lot of these athletes are later in life developing all these weird brain maladies because of chronic head trauma. And truth be told, listen, that's why we watch most of the sports, right? You want to see the head banging. But it really isn't safe for the athletes in the long term.
Let's look at some symptoms, common symptoms that can be associated with brain inflammation. So I see patients that present with memory loss, trouble concentrating, while doing certain tasks, etc., or just having more difficulty with problem solving. And these can all be related to inflammation to suggest to you that something is not right, something is going on. Like, we need to look more into this. Mood disorders, like we spoke about, depression is a big one, but also being more anxious, getting overwhelmed easily or easily irritable can be one of those signs. There are definitely physical symptoms such as fatigue, easy exhaustion, headaches, trouble sleeping, behavioral changes such as change in personality, like your spouse or your kids may tell you, is there something wrong? Just you not being yourself. And sometimes you can also have sensory problems such as numbness or tingling that may suggest that you've got some nerve irritation going on somewhere. It could be brain related. So these are all things that may make you think that something is going on and you may need to get checked. So types of brain inflammation, again, acute and chronic inflammation. Acute inflammation, let's say you fell, or we just talked about the contact sports, whether you have a concussion or something like that. Then the brain brings in a bunch of mediators, increases blood flow to that area. You have all these cytokines and other things coming in that helps to repair that injury. So that acute inflammation is good to help to repair, but sometimes that leads to a chronic inflammatory state. And then that's when you have all the other tissue damage happening because you've got too much of this inflammatory substance coming in. And you can actually have some of your neurons or of the cells in the brain dying because of the inflammation. This can then lead to chronic diseases. So you would want to see your physician. They would want to take a good medical history, physical exam, imaging, whether it be MRI, CT scan, whatever. There's some now really advanced imaging of the brain that can really get down to function of the brain, not just the anatomy, but show you how the brain, different areas are functioning. And of course, blood work to rule out anything else, any metabolic, things that may be causing this distress to your nervous system. There may be something else going on underlying that you're not aware of. And definitely early diagnosis matter because the time to get to the real root cause of brain inflammation is very important. Yes. The longer you have chronic inflammation going on in the brain tissue, then you have these long-term side effects from that you may never regain full function, actually. And so that can happen with a bunch of these different brain conditions. The longer you leave it untreated, the more permanent those effects or whatever effects the inflammation is having on your brain, the longer lasting they would be, unfortunately.
Now, if we break down Alzheimer's, because that's a big one that we know a lot of patients are worried about as they're moving into the 5th and 6th and 7th decade of life. There've been a lot of improvements over the last, I would say, couple decades in Alzheimer's treatment as well as Alzheimer's diagnosis. I know within our practice, so those of you who know us, we're very forward thinking when it comes to treatment and diagnosis. And also, I'm a huge believer, and so is Dr. B, in aggressively chasing down the root cause of an issue. Now, so for patients, if you know someone who is struggling with memory issues or struggling with just activities of daily living and cognition, there are some actual blood tests that they can do now that can help us, that can guide your healthcare provider, your physician, to a potential diagnosis of Alzheimer's. I know the one that we love to use in our practice is called the ATN profile. Now, for those of you who don't know what ATN stands for, ATN stands for amyloid, which is amyloid plaque. T is for the tau proteins, and the N is for neurofibrillary tangles. And those are three of the most common protein abnormalities that we see in the brain for patients who actually are carrying a diagnosis of Alzheimer's disease. So they have found a way, the lab has actually found a way to extract those proteins from the blood peripherally and give us an idea as to what the likelihood of a patient having Alzheimer's disease is based on the ratios of those proteins. Pretty cool stuff. We began doing that like almost 8-9 months ago. Actually, fall of last year we began doing that in our practice, and it's really helped a lot of patients, properly navigate their memory journey or their issues that they might be having. And then that leads us to do further imaging, like Dr. B mentioned, the cooler imaging studies out now. There's one, the PET CT of the brain, where it literally will look for the area in the brain, the hippocampus in general, and it looks for the amount of uptake of the actual contrast media used for it in that area. And based on that, we can extrapolate and say, okay, good, based on the amount of disease we're seeing on the image, this particular patient has an increased risk of having Alzheimer's disease.
Right.
Now, it's not all doom and gloom. I like doing these tests, and Dr. B does too, because it helps us to guide patients. Okay, here's where you are. Here's where you could be if you do nothing. So what are we going to do between the spots? So now it's the time to make an effort to make certain changes. So it's not all loss. It's not all doom and gloom if you find out, so I do have an increased risk. Yes, you do, but it's not the end of the world. We can actually do things. And I think this is where a lot of the talk on Alzheimer's disease gets lost, because people tend to think it's a one size fits all diagnosis where you just treat it and it's gone, when if you just make certain lifestyle changes with regards to your brain health, even if you do have the predisposition to have Alzheimer's, which is the ApoE gene, or you do have the abnormal plaque proteins in the blood, you can still make a change and you can still begin to make headway in making things better for you down the line. So, I mean, it's just talk to your doctor, your healthcare provider about those tests. The ATN profile, it's offered locally at the lab. Was it, I think, LabCorp
is that one.
And then the PET CT of the brain, it's called the amyloid PET CT. That's available at most of the actual radiology places here where we live in Tucson. So it's a good thing. I would say if it were me, I would do it, because knowing my baseline, it gives you a fighting chance versus waiting years and years to find out, oh wow, this is why dad's like this or mom's like this, or oh, this is why I'm like this. So I love the way the science is heading. I think it's going to be huge, but also we're firm believers in prevention. So if you can do things to change things now, that way you don't have to worry about having this as something to deal with later on.
I mean, literally a couple of years ago, we didn't have this type of testing for Alzheimer's.
No.
And I remember, like, back in med school and even training out of med school, we had to tell patients, well, we don't have any testing for Alzheimer's. It's a clinical diagnosis. So we would diagnose based on just symptoms and history and, family history, genetics, etc. But by the time most of them were diagnosed, it was far gone.
Yeah.
Because you could have mild symptoms that, if left untreated, can get worse and really get debilitating after after a time. And I'm sure a lot of us have seen loved ones suffer from that disease. But now with the advent of these new testing, I mean, if you suspect something, why not get tested so you can jump on getting that treated, do something proactively to prevent it from getting worse, or even regain some of the function that you've lost.
That is true.
So, and I'm sure in the next few years, there's going to be a lot more coming down in terms of testing for these brain conditions, especially Alzheimer's, because there's been an increase in that one in particular. So why not take advantage of it? It's out there. If you have symptoms, talk to your doctor, mention the blood test and the brain scan, and let's see if we can get something going for you.
Yeah, and if we're talking about, me, I'm going to be that guy, right? So I'm going to have some data here. So, we're always talking about, lifestyle. And the big one for me and my patients, we always talk about alcohol and the effect of alcohol on the brain. And I think it's important, and it's not put out properly in the media how detrimental alcohol is to the brain. So I got some notes. For those of you out here who still think it's okay to have my glass of wine or 2 glasses or my highball in the evening or my Jack and Coke, I mean, you're doing yourself a disservice. So short-term effects of alcohol, impaired cognition, right? We know that. Memory deficits. I mean, the college kids who drink too much, what happens to them? They black out, right? And they wake up the next day, dude, what happened? Bro. They don't know, Motor dysfunction, you can't walk, you can't, and the sedation, you sleep, I mean, these are things that people need to know. And that's short-term. Long-term, when you drink alcohol, you're killing brain cells. Straight up.
Right. So you're creating that acute inflammation each time, and with continued use.
You're just perpetuating it, because you have to have your 2 glasses at night, because some study back in the day said it was okay to do that. And by the way, that study, I'm going to tell you right now, I wish they didn't come out with that, because the same benefits you can get from the glass of wine, you can get from a serving of blueberries.
Yep.
Straight up.
The antioxidants.
Or a serving of the currants or the grapes, the antioxidants and the resveratrol. Those two are pretty much what is in wine that's good for you. And you can get it without having that cancer-causing effects of alcohol. So it's just something to think about. I had to put that out there because it's important that people understand that hey, if you want to enjoy a glass of wine with your honey, that's fine, do that, but not with the frequency at which I am hearing patients and people are doing it, which scary.
You can tell that this is one of Dr. G's pet peeves.
It is a pet peeve of mine. Most definitely. I mean, we're longevity physicians, so I would never tell patients to do something that in my eyes is going to shorten their lifespan. No. Or their health span, important.
Health span. Here are some strategies for promoting good brain health. And we've talked about quite a bit of this already in this episode and previous. So we've talked about diet, eating foods that's rich in antioxidants. So we're talking fruits, vegetables, whole grains. Healthy fats, omega-3s, you can get it from eating foods such as fish, seeds, nuts, and you can also take it via supplement. And we'll talk about the supplements in just a bit. Of course, limiting the processed food. And we spoke about the Mediterranean diet, having all the above foods, healthy foods within it. And it's great for not just cardiovascular, but also brain health benefits. Mm-hmm. Physical activity, just to boost that brain function, increases blood flow, reduces inflammation, helps to promote new brain cell growth. Who doesn't need that? Aim for about 150. So the Cardiovascular Society has recommended at least 150 minutes of aerobic exercise per week. And so that's where the recommendation of 150 minutes at least comes in, because that will help to promote good heart and brain health. Of course, doing things that you enjoy, taking a walk, going for a swim, doing that yoga class, that's all good to help with increasing your endorphins release, stress relief, and just to help to promote good brain flow.
I know our producer of our podcast, he loves Zumba. He's a big Zumba guy. It's crazy. He's heavy into it. I was surprised. Great guy.
Well, Zumba is great, Zumba is great because you need a lot of coordination to do Zumba.
That's why I was surprised. That's why I was surprised he was doing it.
So you're not just exercising, you're using your brain cells quite a bit because you got to stay in line and not fall, not trip.
I'm telling you, the guy.
Not trip over the next person.
I mean, he calls himself a Zumba king. I was like, that's a thing? Apparently there's titles. He's created.
I wonder if he's going to cut that out of this episode.
Okay. He might do that.
All right. Back to strategies. Of course, sleep and stress management. We talked about getting good sleep, getting a tracking device that can track your sleep as well and let you know if you're getting restful sleep or if you need to do something to adjust that. Stress reducing techniques such as meditation, deep breathing, any kind of activity that promotes mindfulness. And of course, seeking help if you have any of this. We touched on depression and anxiety from the increased inflammation and just getting help with that, getting that addressed. Brain training exercises. So there are a number of cognitive exercises that can help improve your memory. If you go online, you can find different puzzles, different games that you could do online that will help to stimulate your memory, cognition, concentration, just help basically exercising your brain. And doing this on a daily basis in addition to your exercise, your eating healthy, will help you to feel more youthful as you get older. You don't want to be that person that says, oh, you know what, I can't remember, but it's because I'm getting up there in age. We don't have to use that excuse with everything that we have at hand. We could maintain at full brain function as we get older.
And since you talked about brain training, Dr. B, we actually own, there's 2 devices that we have at home right now called the Brain Tap. It actually is a pretty cool sensory device. It's a headgear that you put on, and it literally has alternating lights, LED lights, and there's binaural feed to the ears, and it takes you to different journeys, they call them, I think, right? And it does help with relaxation. It helps to amplify certain brain waves to help with kind of keeping calm or neuroexcitation, just to get other parts of the brain kind of activated. So there's some pretty cool the term biohacking has been thrown around, but some pretty cool devices out there, and also apps that can help. I mean, another one that we use or we love to use is called Newcom, and that's actually, now mind you, we're not getting paid by any of these. We like them because we use them because we like them. We've used them before, and that's why we bring them up. But Newcom is a pretty cool app that you can get, and that one is primarily, it's just an app you put it in with your headphones and literally goes through those journeys, and you will see, or you can see, improvements in just well-being, cognition. So there's I love where the brain science is going. I've always been a brain nerd, even in med school. Before I went into primary care and Regen Med, I actually wanted to be a neurologist.
True story.
Yes. And I just I was always fascinated by the brain. So I think at this part of my practice life, that's why I'm passionate about people keeping their brains. Do whatever you can to keep your brain, because honestly, you get one. That's it.
Absolutely. And there are a lot of apps. There are devices as well, too, but there are a lot of those apps like the Newcom. There's Calm by itself. There's a few others that we've come across. And a lot of them actually came about during the pandemic as well, too. That's when we saw a lot of, not just COVID causing a havoc in your system, including your brain, but also the increase in anxiety and depression with the whole shut down isolation and people not knowing what to do, everything going virtually, losing contact socially. So a lot of these apps came about during that time. But we know that the world has become even more stressful since then. So it's definitely coming in handy right now.
I'm moving back to Mars. I'm done. All right, so let's talk about what I love a ton, supplements, because guess what? The food we eat, there's nothing in it anymore. It's so hyper-processed. So we are firm believers in having supplementation, but being smart about it. So let's talk about this list here. So omega-3 fatty acids, talked about it, easy to get, found in fatty fish. You can find them in flaxseed as well as other plant-based options. What omega-3s do is reduce inflammation. That's what they do, which is important. And they help to support the cells when you take them. Okay, with omega-3s, just be careful. Look with any supplement you take, look up the company, make sure it's a reputable company, make sure they have a good track record, because you don't want to be taking rancid fish oil. And that's what omega-3s can be if you're not careful or pick up a cheap brand. I always like to tell patients, even if it's $9.99 for the bottle, be very careful. You want to invest. You're investing in your health. So just be smart about what you buy and don't always go the cheap route. Do your research. Get good supplements. Ginkgo biloba, oldie but a goodie. Everyone knows ginkgo. And this one, there are some studies that show it does improve memory because of the way it boosts blood flow, the vasodilation effect of this particular supplement. So it's a good one to be on.
Absolutely. Bacopa is an extract that I'm seeing more and more in newer brain supplements now. It's been found to help to enhance your brain functioning. So learning, memory, focus, concentration, all of this. And usually it would be in the supplements that you take in the morning that helps to kind of just wake up your brain and help you to function better. I actually like some of the supplements. I take some of the supplements with Bacopa. Helps me to focus on my patient care a little bit better during my day. Phosphatidylserine. This one has been around for a while and incorporated in a lot of different brain supplements. You can find it by itself as well. It actually helps to support that lining of the nerves, the nerve sheath. It helps to support brain health in that way. And it helps with sleep as well as memory and attention. So this one, a lot of people take it at night because it actually does help with restful sleep as well.
Cool.
Rhodiola is one of what we call an adaptogen. So there are some supplements that help us to balance our stress levels. So it helps with our mental health significantly. Rhodiola, you usually find it with other supplements that are typical to help with typical adaptogens such as ashwagandha, some other Chinese herbs. Nice. Licorice is one of those as well too. It works very well with some of the other supplements that help with mental health and mood, and of course reducing stress. Again, there's that word stress. That's everywhere. So anything that we could do to reduce stress, to reduce that inflammation on our system.
Next up, we have paraxanthine. Now, this is actually a pretty cool, newer molecule that actually was found when they were doing research on caffeine itself. It's a byproduct of caffeine, and it's been touted as being that nutraceutical or supplement, so to speak, that can basically give you the benefits of caffeine, which is that attention, focus, without the jitters and the negative effects of caffeine. So it's actually a pretty cool one. And there are some good supplements out there with paraxanthine that can help people with focus issues. I mean, it's even being touted to help certain people who have attention issues. So it's a good one to be on. Once again, it's like coffee without the caffeine, but it's in supplement form. And alpha GPC, another one that we know well about. It's one of the mainstays for a lot of more potent neuroformulas out there in supplements, in the supplement space. Can help to enhance memory, cognitive function, and even recovery, because it's all about decreasing inflammation and increasing blood flow.
Thank you for listening to us today in another episode of Vitality Vault. Today we spoke about brain and inflammation and the effects of it, what we can do to combat it, different testing that you could be proactive about asking your doctor for, and just healthy practices that we could do on a daily basis to help to combat that.
Hope you enjoyed this episode, guys, and we can't wait to get you back in the vault where we discuss another cool health topic. Take care.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.